Good afternoon and greetings and welcome to all of you to this Belt and Road Initiative Symposium 2020. To begin with, I would like to wish you a good afternoon and welcome to the Honorable Professor Dato Dr. Wilson Yong, the President and Advisor of the Symposium. Welcome, sir. I would also like to welcome Dr. Damian Lee, who is the chairman of the BRI Symposium and who represents the Malaysia Maritime Silk Route Research Society, and the co-organizer of the symposium, which is Dr. Zarina Amin, the director of the Biotechnology Research Institute. So esteemed speakers who are present with us today, and members of the press, ladies and gentlemen, I would welcome you to this symposium. And the title of the symposium is the Safety Regulatory Challenges of Transnational Biotechnology R&D Projects Symposium 2020. So welcome, and we look forward to your participation in this symposium. Now, the threat posed by biological agents in this area of globalization and the emergence of novel pathogens poses significant challenges to the global community. And research in this area is guided by regulatory principles. So this conference and this symposium has been set out with the objective of exploring these regulatory challenges. So I welcome all the speakers, and without further ado, I now call upon Dr. Damian Lee, who represents the Malaysia Maritime Silk Road Research Society, to deliver his welcome speech. Welcome, Dr. Damian.
Thank you, Professor Kenneth. Yep. A very good afternoon and selamat petang to everyone, especially to our co-chairman, Dr. Zarina Amin, the Director of Biotechnology Research Institute, UMS, Professor Dr. Wilson Yong, Chairman of Malaysia Maritime Silk Road Research Society, 5 distinguished panel speakers from various parts of Malaysia and Indonesia, Dr. Chaya, Assistant Director of BRI, and distinguished guests, ladies and gentlemen. It is my great honor and privilege to warmly welcome each and every one of you this afternoon for connecting and joining us virtually, accelerated by COVID pandemic, to participate in this most timely and pertinent BRI Symposium. Now, this symposium, as Professor said, Safety Regulatory Challenges of Transnational Biotechnology R&D Projects. Now, first of all, as organizing chairman, and on behalf of Malaysia Maritime Silk Road Research Society, I would like to convey my sincere thanks and gratitude to BRI Institute UMS for so kindly accepted our invitation to co-organize this seminar. Now, I would like to record a special thanks to all distinguished panel speakers for accepting willingly our invitation and with us this afternoon to unpack and to share their most valuable insight and expertise on the various issues. Now, to all invited guests, banyak terima kasih for responded overwhelmingly to our invitation and to hear us out on the latest on the what, the how, and the why of the importance of biosafety and biotechnology. Now, we thank our sponsors, Nixon, Malaysia, for your sponsor this afternoon. I would like to share a little bit Can you see the screen, everyone?
Yes, it's okay. Yes, that's correct.
The emergence and the re-emergence of diseases all pose unwarranted and significant public problems and have plagued our nations civilization for decades. Now, in lieu of becoming the first world developed country, Malaysia in this year ushered in a significant and notorious coronavirus we call the SARS-CoV-2 or COVID now. In order to do a proper risk management or better lab practices, preparedness and response to COVID, additional refining guidelines, policies, and procedures are needed. Now, this begs the question as to what are the potential risks biotechnology has when all these labs are really researching on this virus like HIV, Ebola, so that they will not accidentally or purposely leak the viruses to the public. Now, a brief, as we said, the purpose of Symposium is to connect people, build networking, share knowledge and issues on these issues, and then create better awareness and understanding of all this and the lessons learned, and suggest doable measure recommendations, perhaps a roadmap, so that we will be more prepared to face all this pandemic, rather than be drowned and overwhelmed again by these challenges and problems. Now, brief background. First reported in December 2019, COVID posed public health emergency in January, attained the status of very high risk category, and by March 11 became a pandemic. By now, it has spread to 250 countries, 15 countries, and more than 1.55 deaths, with 68 million active cases. Now, COVID pandemic is still unfolding, with US the most affected. You can see here 290,000 deaths and more than 15.4 confirmed cases. Now, the blaming game started among superpowers on the origin and accountability of COVID-19. Now, the blaming game intensified, and the WHO has to come in to calm the situation. The Director General flew into Beijing on 28th of January to get a first-hand information and approach on the outbreak. And after that, he praised the seriousness of China to tackle this outbreak, especially the commitment to share data and the genetic sequence of virus, and the pledge to work with China side by side. Now, blaming game triggered a war of misinformation, disinformation, and create tensions between the powers, superpowers especially. Misinformation and disinformation spread like wildfires because almost half the world was, and is being locked down, and everyone was on local and international social media. Now, WHO warned this is a coronavirus infodemic, and it says that fake news spreads more quickly and easily and more dangerous than the virus. Meanwhile, US alleged Moscow rolled out Russian misinformation and disinformation, and America retaliated with their emergency center for engagement. Now, the next issue, the health endangerment by deploying the biolabs around the world. These risks and health issues play out into the open. US has got about 25 biolabs in countries in Middle East, Africa, Southeast Asia, and the former Soviet Union, 16 in Ukraine alone. And there have been reports that some of these places where the labs are have seen large-scale outbreaks of measles and other diseases. Now, from blame game, it works towards cooperation by November, when US company Pfizer chose 9/11 to issue a press statement indicating that COVID-19 vaccine candidate mRNA have over 90% effective. However, many questions left unanswered because it's only a Pfizer press statement, not a peer-reviewed journal article. Again, huge problem like logistical costs of manufacturing, transporting, storing, especially at minus 80 degrees Celsius. However, UK became the first country to give EUA, emergency use authorization for Pfizer for their vaccine in early December, and will start their inoculation by next week. Malaysia, on the other hand, pre-ordered 12.8 million doses of Pfizer vaccine in November, even before any EUA was issued. Moderna released data as well as the China COVID, Sinovac, for urgent, and they've got 3 for emergency use program. And their vaccines developed by using different conventional, well-tested vaccine technology of the inactivated natural virus. Now, last Sunday, the first batch of 1.2 million doses of vaccine ordered from China, Sinovac, arrived in Indonesia. The second shipment is due in January of 1.8 million doses. And the president of Indonesia confirmed that Sinovac will ship raw materials of 45 million doses to Indonesia for Indonesia's own pharmaceutical firm, PT Biopharma, to process in Indonesia. Now, most recently, the APEC 2020 hosted in Malaysia. They issued a joint statement saying that this year's APEC's overarching goal is the recovery of COVID-19. And President Xi Jinping emphasized that China's promise to make vaccine, the COVID vaccine, especially China one, a global public good, and ready to step up cooperation with other countries for R&D, production, and distribution, and to help all developing countries to make China's vaccine a global public good, accessible and affordable to everyone around the world. So I hope among us today, we have experts, distinguished research, knowledgeable scholars of Malaysia, Indonesia, to share, to unpack their views and insights on all these issues. And I hope this pooling of expertise from these experts will make an exciting, interesting, multi-dimensional understanding of the issues. So I believe this symposium puts forth some suggestions on measures for roadmap, perhaps seeking sustainable, collaborative, cooperative development for all stakeholders to address all the issues for the greater global and regional common good. And with that, I hope all of you will enjoy this symposium, and we look forward to a dynamic, engaging, and really dynamic symposium. Thank you, everyone.
Thank you very much, Dr. Damian Lee, for your excellent presentation. You have provided an overview of the current situation pertaining to the information and the misinformation campaign, and also the initiatives by China to promote the vaccine amongst the Southeast Asian countries. So I now open the floor for question and answer, and the way the participants can engage in the question and answer is by clicking on the Q&A box at the bottom of your window, and you click on the Q&A box, and your questions will be visible to the moderators, and the questions will then be posted to the respective panels. So we will wait for question answers over the next 5 minutes. Dr. Boeing, is there an avenue for them to post their questions via the microphone as well?
No, unless the host enable them to ask verbally.
Okay,
But excuse me, Dr. Kenneth, I believe we are rushing out of a bit of time because for the chairperson, we don't expect Q&A. Can we just move to the introduction of the first speaker today?
Okay, thank you, Dr. Boeing. So
thank you.
I will close these windows. Okay, our first speaker for this afternoon is one of the uh, eminent personalities who has been instrumental in promoting biosafety and biosecurity in Malaysia over the past few years. I welcome Dr. Haja Zalini Yunus, who is the Senior Director of the Biological and Toxin Weapons Convention Nucleus Science and Technology Research Institute of Defense, STRIDE, Malaysia. Dr. Zalini has graduated with a PhD in chemical engineering from the University of Manchester Institute of Science and Technology, UMIST UK. She is involved both nationally and internationally in strengthening the Biological and Toxin Weapons Convention, and she has been actively promoting the implementation of biorisk management program focusing on biosecurity measures in Malaysia in fulfilling national obligations to the convention. She is the chairman of the Inter-Agencies Technical Committee related to country obligations to BTWC, and she is the national contact person and the coordinator related to the country's collaboration in the biosecurity and biorisk management program. So with all of this background, Dr. Zalini is the best person who can address the current situation, and I invite her to deliver her presentation.
Okay. Assalamualaikum and good afternoon. Thank you, Dr. Kenneth, for your kind introductions. Firstly, I would like to express my sincere appreciation to the organizer for the invitations to participate in this very important symposium. Unfortunately, I have not prepared presentations related to the COVID-19, but it's more on the strengthening laboratory biosafety and biosecurity. Before I proceed any further, I think it's be good to introduce some key concepts of biosafety and biosecurity briefly. Let us start with biosafety. Biosafety is defined as the containment principle, technologies, and practices that are implemented to prevent unintentional exposure to the biological agent and toxin and their accidental release. There are many biosafety measures are shown here on the slide, for administrative control, engineering control to personal protective equipment. While biosecurity is defined as protections, control, and accountability measures implemented for the high consequence pathogens and related resources within laboratories in order to prevent the loss, theft, misuse, diversions, and international release. Biosecurity programs depends upon 5 pillars, which are physical biosecurity, personal reliability, transport security, information security, and also material control and accountability. Another term is biorisk, which encompasses risk from the biosafety and biosecurity perspective associated with the biological material. To manage the biosafety and biosecurity risk, it is recommended that institutions develop biorisk management system. Biorisk management is defined as analysis of ways and developments of strategies to minimize the likelihood of the occurrence of biorisk. Biorisk management utilize the assessment, mitigations, and performance or AMP models whereby mitigations are conducted based on the risk assessment and that the effectiveness and suitability of the control measures or performance are then evaluated. Biological risk and threat can derive from natural occurring disease outbreak and also from accidental release or laboratory acquired infection, and also known as LAI, and deliberate release of infectious agent or toxin. And then the example is heard just now currently is COVID-19, whereby the deliberate or unnatural biological threat carry out risk because pathogen may be engineered or released in such a way that to make more harmful to susceptible human or animal population, and the impact may be catastrophic and at a national or to a global level, affecting not only public or animal health, but also the economy and the environment of the countries. In the recent year, the dual-use potential of advancing life science research and technology used in research has led to an increase in the dual-use threat, which there is the potential for the same piece of biological research with legitimate scientific purpose to be used for peaceful purposes or to be misused to pose biological threat to the public health and nation security. As described from the previous slide, advances in science and technology clearly have many benefits, but also present new challenges as good science and technology can put to a bad use. And shown in this slide, much of the technology in life sciences are used to develop new vaccine and treatment and to find new ways to protect ourselves, as well as safeguarding animal and plants. However, high consequence pathogens and emerging technologies have significant inherent risks that come partly from the possibility of accidental release, but also from the potential misuse for malicious purposes. A recent report by the United Nations Institute for Disarmament Research in UNIDIR on advancement in science and technology in the life sciences, implications for biosecurity and arms control. The authors has discussed trends in 3 key technologies that are facilitating advances in different areas of life sciences. These 3 expanding technology, which are developments in genetic technology, nanotechnologies, and artificial intelligence, have made a cross-cutting advances in multiple fields of life sciences, bringing about many benefits, but also pose certain security implications. Shown on the slide is the summary of how this technology are impacting the 5 different fields of life sciences, namely immunology, neuroscience, reproductive technology, animal and plant, agriculture, and infectious disease. For example, in this field of immunology, its improved understanding of immune response can contribute to improved therapeutic to treat disease. However, the same knowledge could be exploited for hostile purposes in new biological weapon system capable of more effectively overwhelming immune response. In the field of infectious disease research, disease response can be improved and aid to creations of new and better vaccines for infectious disease. However, some research in this area, such as the synthesis of horspox virus and the modification of a strain of highly pathogens avian influenza, have raised a number of safety and security concerns. Research and development in this field is overwhelming, undertaken for peaceful purposes, but there are a number of ethical, legal, safety, and security concerns. Therefore, to control or to reduce these biological risks and threats, we need a mitigation strategies. One way to strengthen biosafety and biosecurity is through the governance of science and technology. From the government's perspective, governance can be through having certain safety and security national policies and regulation framework regarding life sciences to facilitate the management of the risk and threat. However, there are also certain limitations and barriers such as political willpower, human and financial allocations that may hinder the effectiveness of such strategy. Therefore, it is essential that the governance of SNT be implemented at the institutions level as shown here in the slide. Institution can be a key player in the governance of SNT and reduce biological risk and threat through developing and implementing institutional policy and guideline, oversight mechanism, monitoring and assessment procedures, and code of conduct. It is also essential that training and awareness educations are conducted essentially among employees and other stakeholders. However, all these will need some level of management support and financial resources. Therefore, the involvement and buy-in from the top management is very important to ensure the governance of SNT is workable. And I find another crucial element is to have someone to champion this cause. And as I have visited many institutions, I have visited many institutions, and the institution have indicated officers who are passionate and are pushing for their various management program to work the most successful one if we compare to institution without a champion in doing this. As mentioned, it is crucial the laboratory personnel gain adequate awareness and are given continuous education and training on biosafety, biosecurity, and biorisk management to handle high consequence pathogens. As I have also mentioned earlier, biosafety and biosecurity risks and threat need to be managed effectively through a management system. There is the latest IO standard in laboratory biorisk management, which is ISO 35001-2019, which is based on the SAN Workshop Agreement 15793 document. This document prescribes in detail how to develop a biorisk management program. I would particularly like to highlight on the Code of Conduct for Biosafety, for Biosecurity, whereby the Biological Weapon Convention for the BWC Biological Weapon Convention also emphasized the adoption of this Code of Conduct as a means to manage the potential of misuse or dual use of life science research. Just a handful of countries in the world has developed a code of conduct for biosecurity, and Malaysia has developed our own code of conduct for biosecurity in 2016. We saw the need to develop a code of conduct for biosecurity to encourage a culture of responsibility for scientists and to raise individual awareness of the personnel responsibility. There are 7 elements highlighted in this code of conduct, which are biorisk assessment and risk management, raising awareness and education, accessibility, accountability and oversight, reporting misuse, management of hazard information, supply, shipments and transportations. And further, another tools that I would like to highlight to enable laboratory to strengthen their biosecurity is the National Laboratory Biosecurity Assessment and Monitoring Checklist. This checklist was adopted under the EU Extended Assistance Program. The main objective for the development of this checklist was to enhance Malaysia's capacity in the area of biosecurity by developing comprehensive biosecurity checklists for laboratory assessment and monitoring. The biosecurity checklist is available both in English and in Bahasa Malaysia. This checklist also available if you want to download from the SRIDE website. The checklist based on the Malaysia expert opinion, and there is 8 elements in the checklist as stated in the slide. This biosecurity checklist can be used by laboratory as a practical tool to enable laboratories that handle and store high consequence pathogens to systematically assess their current level of biosecurity, identify gaps in existing programs, efficiency and effectiveness to ensure institutions have the necessary biosecurity measures implemented to prevent potential of accidental or deliberate release of these high consequence pathogens. So in conclusion, it is important that we recognize there are potential bio-risks and threats, that these risks and threats are real. SNT advancement have many benefits. However, this technology could be intentionally misused for harmful application and thus could be enabled for the bioweapon development. Biosafety and biosecurity measures and biorisk management system are critical for the protection of personnel from the high sequence pathogens and to reduce the threat of damage from intentional act and misuse, including terrorism or crime. Therefore, it is essential for research institute and laboratory to develop and implement effective biosafety and biosecurity policy and measures, and to strengthen existing biosafety and biosecurity management system or measures to ensure life sciences activity can be conducted in a safe and secure manner. With that, I thank you.
Thank you very much. Thank you very much, Dr. Zalini, for providing an excellent overview of the current situation with regard to dual-use research of concern. This is one of the areas which is explored in the area of biosafety and biosecurity. So dual and the emergence, as you mentioned, of synthetic biology has raised the specter of non-state actors getting involved in these development of new biological agents. So with that, I would like to open the floor for Q&A. So as mentioned earlier, please click on the chat box and I will respond to the Q&A. So we have a question from Dr. Chris Wu from IPB. And his question is, what are the evaluation, information, distribution regulation to be done in Malaysia on the vaccines COVID-19, especially those that are GM viruses? So perhaps Dr. Zalini can take that question. I think he's asking about the process of evaluation for the GM vaccines.
I think I'm not expert enough to answer that questions. Maybe other panelists would like to answer that questions.
Do any of the panelists want to take that question?
Because I'm not involved in that.
Yeah, so I would wait for perhaps some of the panelists who are involved in regulatory frameworks can take that question. Or if not, we will pass it on and we will answer it at the end of the session, or we will respond to you in due course. Okay, with that, we would, I have no further questions in my question and answer box. So with that, I would like to thank you, Dr. Zalini. Thank you very much for your presentation, and thank you for enlightening us on the issues related to regulatory frameworks and EURC. With that, we now move on to our next presenter. So our next presenter for this session, Dr. Chris can project the screen. Okay. It'll take some time. Okay, thank you. Thank you, Dr. Chris. So our next presenter for this particular session is Professor Dr. Sazali Abu Bakar. So many of us who have attended biosafety and biosecurity training are probably aware of the Tropical Infectious Disease Research and Education Center, or TIDREC, as it is well known, at University of Malaya in Malaysia. So Professor Sazali graduated with a PhD in microbiology and virology from the University of Texas Medical Branch, USA. He's a senior professor of University of Malaya since April 2008. He's a director of the WHO World Health Organization Collaborating Center for Arbovirus Research and Reference, DFDHF, since April 2009. He's a fellow of the Academy of Sciences Malaysia. He's the chairman of the IBC, Institutional Biorisk and Biosecurity Committee. He is also on the committee at the University of Malaya since 2013, and he's active in national and international grants, and he has published in well-recognized journals. So many of us who have been associated with Professor Dr. Sazali know his expertise, and I now call upon him to deliver his presentation, which is Pandemic Preparedness Lessons from COVID-19. Professor Dr. Sazali, I welcome you.
Thank you, Kenneth, for that very kind introduction. It is my pleasure to actually to give a talk here. I do not know. I think I'm having problem with sharing the screen.
Okay, so you can perhaps. Is your PowerPoint open, Professor? Is it open?
Yes. Can you see now?
Yes,
yes,
that's perfectly okay. So you can just click on slideshow. Okay, it's perfectly okay now.
Yeah, thank you for that kind introduction. Yeah, after Dr. Zalini's talk, now I feel more comfortable to talk because think the basic principle of biosafety, biosecurity has been introduced by Dr. Zalini. So today, what I will do essentially is to share with our audience our experience, on working with the coronavirus, SARS coronavirus 2, or commonly known now as a COVID-19 pandemic. So it is more of a sharing session, I hope. Then bear with me. We will share our experience so that it can be of use to other people in the future. Specifically, I chose the title Pandemic Preparedness, lesson learned, but actually we are still in the middle of pandemic, there's still a lot of things for us to learn. So nonetheless, there are a few things I think that we can learn from now on in preparation for the next pandemic. God forbid we don't have to deal with this extensive pandemic. So I would like to take this few seconds or minutes to introduce to you the center that I am at, TIRAC. So we started in 2008, and as a center for tropical infectious disease research in the Faculty of Medicine. So it was just an outfit research center from the Department of Medical Microbiology. But something happened in 2009. This is almost 10 years after the Nipah virus outbreak in Malaysia. We finally managed to acquire a biosafety level 3 facility to allow us to do select agent research, basically on Nipah at that point. So once we got the facility, in order for us to train our personnel to work in the BSR3 facility, what we did was that in 2010, we established what we call mock biosafety level 3 training facility. Basically, we have trained almost more than 500 already of microbiologists and regulators and whatnot in biosafety, especially in biosafety level 3 at this particular training center. So fortunately, by 2013, we become recognized as the University of Malaysia Center of Excellence. And then by 2015, we acquired the mobile BSL3 facility. So you will see later why these are all important milestones as far as TIRAC is concerned and also for the country. After we got this mobile BSL3, naturally we have to move forward. So by 2017, we managed to get accreditation for our laboratory diagnostic services. And then by 2019, we were recognized as the Higher Institution Center of Excellence under the Ministry of Education. So in TIRAC, basically, we have 7 different divisions. But what I want to highlight, there are 3 different divisions that are important for the talk today. One, as you can guess, the high-level biocontainment research and training facilities, as I mentioned to you. And then of course the other one is the WHO Collaborating Center for Arbovirus Reference and Research. This is where we develop reference diagnostics. And then we, as I mentioned to you earlier, the Quality Assurance and Training Program under Biosafety and Biosecurity divisions. And more recently, for those of you who have been following us, we are also now into vaccine and protein therapeutic development space, in which we just got funding to work on vaccine development. So thank you to Dr. Damien, who introduced to us the COVID-19 pandemic, the history or the chronology of it. So what I would like to do in this particular slide is to highlight what are the critical events that I think are important for us as part of learning experience. Looking at how it started, it was December 19 when China first started the investigation on outbreak of mysterious illness. And you look at after that, by January 3rd, WHO was informed of severe pneumonia of unknown etiology in Wuhan, China. And 4 days later, January 7th, virus was actually recovered from patients with severe pneumonia. So within 4 days, virus was isolated. And then January 10, 3 days after, novel coronavirus genome sequence was released to the world, basically. So this is another critical event that took place. First, virus isolation, and then the genome sequence was made available. 10 days later, January 20th, human-to-human transmission was made known to the public. Yeah, and January 23rd, yeah, 2020, basically Wuhan introduced the first citywide lockdown or closed border, as I call it here. Yeah, and then by January 30th, WHO already declared public health emergency of international concern, and by February 5th, the number of cases already got to 25,000 with 494 deaths. So this is alarming. Yeah, and you look at it by February 11, yeah, the disease is named COVID-19. So everyone seems to be expert on COVID-19 nowadays. Yeah, and then by March 11, it was declared pandemic. So the timeline is very important, and I noted here the critical events are these 4 events that took place back then. Yeah. So what about in Malaysia? Yeah, so what happened in Malaysia? So when China started the investigation, January 9, and then right after that, we had tourists from China coming through Malaysia to Singapore, was tested positive on January 23rd. Yeah, so take note. And then public health emergency was actually declared 7 days after that. Yeah, and then by February 4th, first local case was reported in Malaysia. And then by February 6th, first human-to-human transmission was recorded in Malaysia. Yeah, and then another critical event that took place in Malaysia, March 11, actually there was a notification of positive case from Malaysia by the Brunei government. So this is important, yeah, milestone actually, because I will revisit this, yeah, why this is important. And then on March 15, in Malaysia, we already got over 100 positive cases recorded daily. Of course, now we are talking about 1,000 over cases daily, yeah? But this is going back in time. So back then, 100 positive cases daily was quite big. And then by March 17, we have 2 deaths. And we all know that March 18 onward, Malaysia introduced the first nationwide movement control order, or in other countries, you call them lockdown, yeah? And March 20th, yeah, as you see here, TRAC became a member of the MOH designated COVID-19 testing lab. But before that, yeah, another milestone for us that I want to highlight here is that by March 12, we already started performing our laboratory testing for COVID-19, yeah, for SARS coronavirus 2 at that point, yeah. This is our important critical events that I will revisit later in my talk. As you will all have seen this again and again, this is how the COVID-19 pandemic in Malaysia. It started with introduction from tourists from China as the first wave, and then we had the second wave just before we introduced the lockdown. And then all our control measures were able to basically flatten the curve, yeah, until week 33 or so, yeah, and then the number goes up, yeah, and it keeps going up and up until we have almost 1,000 cases daily lately that I given up already on keeping track on the number of cases. So what is important is that on 20th March, we become the designated MOH Ministry of Health Malaysia Special COVID-19 Testing Lab. So these are all my staff in the labs. We have all these old facilities, old equipment in the lab. So the reason why I'm highlighting this equipment is that in case among the audience there are people who wants to donate more modern equipment to us, yeah. So what is important, yeah, on 21st March 2020, we actually conducted biosafety management training program for staff from Malaysian Genome Institute. So we have been involved in biosafety training since 2007. So 21st March, remember that we introduced our movement control order on the 18th of March, yeah? So 21st March, we actually trained, because at that time we need more people to be involved in COVID testing. So we trained personnel from Malaysian Genome Institute, yeah, on how to work in a biosafety laboratory, containment facility. And then this is what I want to highlight is that we were able to finally deploy our mobile BSL-3 facility that I mentioned to you earlier. We have been having that facility with us for some time, but never got a chance to use it until 29 March 2030. We actually mobilized our BSL-3 laboratory facility. Yeah, as you can see here, this is how we got it going, and this is how it is inside the laboratory. And these are all these researchers doing the laboratory testing in the biocontainment laboratory facility. Okay, and then from there on, since the 31st March onward, our lab has been involved in COVID diagnostic, and until now, until today, as we speak, we're still receiving samples for testing in the laboratory. As you can see that all my staff are fully geared, fully equipped to do all the testing in the lab. Okay, we were also fortunate to host the Minister of Health, on April 5th. Yeah, so he actually came and visited us and see our laboratory and how we do things. Yeah, and then in addition to doing the diagnostics for the country, for Ministry of Health, we also did full genome sequencing of the SARS coronavirus. By July 17, we had sequenced 6 full genome of the SARS coronavirus. We developed the protocol that will allow us now to sequence within 48 hours. Yeah. And then by October 28th, we have done 30 full genome sequence. The only limitation that we had was money. You all know that doing sequencing is expensive. We could have done a lot more, but those are all the money that we have in our kitty. So we are showing you our old machine again for those of you audience who have willing to donate equipment to us. We'll be very happy to entertain. And then these are the phylogenetic trees of the COVID-19 virus in Malaysia, among those that we have sequenced and also the rest. So what I'm trying to highlight with our experience is that TRAC, basically in the last 10 months or so, has served as a second line diagnostic laboratory to complement the Ministry of Health. Basically, Ministry of Health laboratories, there are 8 to 9 of the laboratories, serve as a primary line of diagnostic services. And then we serve as a backup diagnostic laboratory for MOH, especially in pandemic situation, where resources are scarce and we need more laboratories to be involved. And at the same time, we were also helping to develop and provide reference diagnostics. Our experience at the WHO Collaborating Center has been very important. So, and our accreditation as an ISO service provider also are very important. As you can see that by March 12th, if I'm not mistaken, we're already offering diagnostic for SARS coronavirus 2 infection. We also train staff in biosafety and laboratory diagnostics, as you have heard earlier. And we also have undertaken laboratory investigation, especially at molecular level, looking at how and where the viruses in Malaysia came from. So basically, those are the contributions of TRAC so far in the COVID-19 pandemic. So lesson learned, with regard to COVID-19 pandemic, number one is that it highlights the importance of the secondary diagnostic and research laboratories in pandemic preparedness. So when we talk about pandemic preparedness, oftentimes we forgot about the important role of the secondary laboratories and also research laboratories. So we can see that when COVID-19 pandemic happened, it highlights why these secondary labs, diagnostic labs and research labs are very important, because it can serve as a complement. It will help to actually provide rapid detection of causative agent. As you can see what happened in China earlier, the timeline that I highlighted to you, the critical events, basically in just a few days after identification, after isolation of the causative agent, actually we can sequence, the laboratory can sequence the etiological agents and make the sequence available to the whole world to allow us to start working on developing diagnostics. And also, as you can see here nowadays, we can develop even vaccines within a very short period of time. In the old days, it used to take 8 to 15 years to develop vaccine, but as you all have heard in the news, we can now develop vaccine within even less than a year. And importantly also, we can now identify route of transmission very quickly. As you can see in China, one of the critical events is that they can identify the human-to-human transmission very quickly, but there is still the question of what is the vector and what is the reservoir. And this is a bit tricky. It will require collaboration among all the institutions in the world to actually figure out where does the virus originate from and so on. So the work is still ongoing. But what is I also want to highlight is that decisive action taken for the containment of the spread of the pandemic. As you all remember, as I highlighted to you earlier, the Wuhan lockdown was unprecedented. And that is an event that will be learned by all students of epidemiology in the future. As you can see, closing the borders of a number of countries also saves the countries from the virus from coming in. As you would have seen the experience of countries like Taiwan, Thailand, and Vietnam, and how they were decisive in making their decisions. And then also we have learned also, if closing borders alone is not sufficient, we need extensive testing so that we will be able to pick those that are positive and immediately treat them and take them out from the community. And of course, there's always the need to undertake continuous surveillance, because many countries, when they have budget crunch, when they have financial crunch, they will cut on surveillance, but which is, I think, not the right thing to do. Continuous surveillance is very important. Well, some people highlighted that why, if we have done good surveillance, why we miss this new virus. But I would like to tell them, look, we know that it's just a matter of time a new virus will show up. The fact that we are prepared to tackle the virus, you can see that we could identify the virus quickly and act on it immediately. That shows you that the continuous surveillance has been successful. And of course, what is more important is that developing local capacity to develop diagnostics, therapeutics, and vaccines. As you all know, that country like Malaysia, because we have not invested a lot in the past on developing local capability and capacity to develop diagnostic and therapeutics, so we are basically at the mercy of other countries. So this is, I think, something that we have to relook again, and perhaps in the future, this is one of those things that we have to address at the national level as a country. It might be costly, but it is something that is important. And another lesson learned is that it is important to have international collaboration. As you see that when the first few cases of positive person who showed up in Malaysia, it was actually notified by our neighboring countries, Singapore and also Brunei. So this is very important. So and also right now we are embarking on vaccine science diplomacy to make sure that we are not left behind in getting the vaccine. So last but not least, I would like to express my thanks to Sandabi Plantation Berhad, who donated equipment which has enabled us to do more testings. And I also would like to express my thanks to Yayasan Nanyang Press for donating the reagents needed to perform the test. And last but not least, I would like to take this opportunity to thank the organizers for graciously inviting me to this esteemed BRI Symposium. And I would like to part by asking everyone to please stay safe, protect, kita jaga kita. Thank you.
Thank you very much. Thank you very much, Professor Dr. Sazali, for your excellent presentation. TRIDREC is a perfect example of how the university facilities step up to the challenge which is faced at the national level, because at the beginning of the pandemic, there was a challenge of testing, and institutions like TIDREC have been instrumental in addressing this challenge, as well as developing capacity over the years. So thank you very much, Professor Dr. Sazali, for your excellent presentation. And we learn more about TIDREC from your presentation. So I would like to now open the floor for Q&A. And there is some question and answer from the I will read out the question to the panel. So this is the question from Dr. Chris Wu again, and his question is, what are the possible hypotheses for the relatively low mortality rate for populations in Southeast Asia, especially in Malaysia, much lower than 0.5%, Vietnam, and there is a possible immunity training by BCG immunization. I think he refers to the BCG vaccine, and that is a possible reason for the low mortality rate. So I will pose this question to Professor Dr. Sazali.
Thank you for the interesting questions. Yeah, I wish I know the answer. Yeah, and it would be nice to have funding to look at it. But I think a number of people has postulated that perhaps our much younger population in Asia could be one of the reasons why. Yeah? So perhaps that this is something that we have to look at. And I think there are a number of studies ongoing looking at the genetics of people, our population. Yeah. As I said, there's a lot more for us to learn. Yeah. And given enough funding, perhaps we will be able to contribute to the knowledge. Thank you for asking the interesting questions.
Yeah. Thank you, Professor Dr. Sazali. I think it also explains why the populations in Italy, Spain, and Portugal with a more geriatric populations have a more higher incidence of the mortality. I think so. So we wait for any further questions. So there are no further questions in the question and answer session. For your update now, we have 56 participants in our session who's online. So we move on to our next presenter for this afternoon. Our next presenter is Dr. Zarina Amin. She's the director of the Biotechnology Research Institute, University Malaysia Sabah. And the title of her presentation is The Role of Biotechnology in Biosafety and Infectious Disease. I will wait for Dr. Chris to put up his slide. Dr. Chris. Thank you, Dr. Chris. Dr. Zarina Amin is the director of the Biotechnology Research Institute, University Malaysia Sabah. She graduated with a PhD in microbiology from the University of Adelaide, Australia. She is a former senior biomedical scientist, National Blood Service, Sheffield, United Kingdom, a former medical laboratory technologist with the Sabah Medical Center in Kota Kinabalu, Sabah, Malaysia, a former medical laboratory technologist, Subang Jaya Medical Center, Subang Jaya Selangor, Malaysia, a former medical laboratory technologist with PathLab Laboratory, Malaysia, Sendirian Berhad, Malaysia, and an active national grant holder with publications in well-recognized journals. For the information of everyone present, Dr. Zarina was our active leader in the COVID screening program in Sabah, Malaysia, when the time during which we had the outbreak and we did not have sufficient capacity. She stepped up to the challenge, and UMS was involved in the testing at the local level. So with that, I would like to invite Dr. Zarina to deliver her presentation for this afternoon.
Thank you, Kenneth, for the very kind introduction. Assalamualaikum and a very good afternoon to everyone here. I'm really happy to be here today to share my thoughts and words today on my topic titled The Significance of Biotechnology and Asian Perspective. I shall now share my slide. Yeah, so I hope I can. Yeah, let me try and share my slide first. Okay. Right.
Okay, it's an okay. It's okay, Dr. Zarina.
All right, like that?
Yeah, yeah. So just slideshow and it should project.
Let's try and see. Is that better?
It's perfectly okay.
All right.
Proceed. Thank
So
you.
I'll just get a straight start, yeah? Right, okay. So today my topic will be on the significance of biotechnology and Asian perspective. Since governments in Asia began to recognize the need for bioinnovation to sustain their country's economic growth, the landscape of biotech research and development in Asia in the past decade has been truly exciting. According to a Biotech 2020 report from marketresearch.com, the Asia Pacific biotech market had total revenues of USD 104 billion in 2019, in which, as we all know and pretty much aware of, it was actually the medical and the healthcare sector that took the biggest slice of the pie at USD 52.9 billion. This was data from 2019 for the Asia Pacific biotech sector. Yeah, so I'd like to start off with defining what biotechnology is all about, as defined by the Organization of Economic Cooperation and Development, which defines a biotech as the application of scientific and engineering principles to the processing of materials by biological agents to provide goods and services. As we all know, biotech has the numerous potential to offer materials solutions to address global problems such as hunger, remediating environmental degradation, and to manage and combat infectious disease, such as the example of the COVID-19. The COVID-19 itself, the pandemic, has brought into sharp focus the pivotal role that biotechnology plays in combating diseases. All around the globe, researchers are churning out various diagnostic tools and treatments against SARS-CoV-2, each designed with increased accuracy, sensitivity, and as well as practicality. In less than a year, vaccines are already underway for deployment as we speak. In Asia, the leaders in biotechnology are primarily Japan, China, Singapore, and Thailand, while South Korea and Hong Kong are newly emerging biotech hubs. Research interests in these countries center primarily on biomanufacturing of chemicals and biomaterials, biosimilars, diagnostics, biomedical technology, and synthetic biology. Now, how did this shift happen? In the light of the recent pandemic, let's take a look at some of these Asian countries and how they performed past COVID-19. In the interest of time, although I've mentioned quite a lot of countries just now, I am only able to cover Singapore and Thailand, yeah? So I'm really sorry about that. So let's firstly take a look at Singapore. Since the early 90s, yeah, Singapore's government has invested in its biomedical sector with an initial startup capital of Singapore dollars 2 billion as part of its National Technology Plan 1995 budget. Currently, in 2020, the public investment in R&D for Singapore stands at about USD 14.2 billion. It's a long way away from Malaysia, but that has actually resulted in a lot of advancements in biomedical sectors in Singapore. So currently, there are about, well, almost all of the top global biopharma companies of the world are centered in Singapore, has got a base in Singapore, and there are about 15 blockbuster drugs which are produced in the country. Singapore's success is also due to the government's initiative of creating a solid infrastructure for bioentrepreneurship, with developments such as Biopolis, Fusionopolis, and Tuas Biomedical Park. As for COVID-19, Singapore is at the forefront of laboratory and clinical diagnostics with various kits for rapid testing as well as for treatment. A most notable test is the recent Breathonics, whereby it is a 60-second rapid breathalyzer COVID-19 test developed by an NUS spin-off company, Breathonics Private Limited. Another notable advancement is the Hummingbird 115 COVID-19 vaccine, which is developed by the locally bred Hummingbird Biosciences Singapore, and it is reported to be ready early 2021. Now let's take a look at Thailand. Thailand has since the last decade been at the forefront of pioneering medical treatments to combat daily tropical infections. The Thailand Center of Excellence for Life Sciences recently reported on the development of a multitude of critical research projects aimed at preventing, diagnosing, and treating COVID-19. And they have generated in less than 3 months over 4 billion Thai baht from collaborations across the country. Thailand has collaborations with various world top universities in biopharma. An example of this is the Mahidol Oxford Research Unit, which works in partnership with the Wellcome Foundation UK for development and research of therapeutics. Currently, Moru is enrolling 40,000 frontliner healthcare workers in Europe and South America at the only large-scale global clinical trial to test whether the drugs hydroxychloroquine and chloroquine can prevent COVID-19. At the moment, Thailand universities and biotech companies are working together to develop 3 separate COVID-19 vaccines in Singapore, one of which is about to begin human trials. Other countries such as India, South Korea, and China are also showing tremendous growth in biotech R&D for their economy. Now, the rapid proliferation of biotech in these countries are driven by a range of economic, social, and political factors. namely new technology and government support. We shall now look into some of these factors a bit more closely. When we talk about new technologies, the growth of biotechnologies used to be predominantly driven by industry. In recent years, there is increasing collaboration between industry and academia, with industry seeking novel technologies from academics for translation and then advising the academics on the needs of the world, while the academics then offered solutions to meet the needs of the industry and saving time and money. Many examples of this are observed, and one of the new ones I'd like to mention and highlight is the recently formed Wilma NUS Corporate Laboratory in Singapore, as well as Moru, as I have previously described. The second one would be government support. Government support plays an important role in driving the direction of biotechnology research. In China, government-sponsored programs offer large incentives to create biotech infrastructure, develop biotech and life science parks, and recruit overseas talents for them to bring back. Legislation is continuously being developed to encourage innovation in China. Biotech is named as a strategic emerging industry, and plans such as Made in China 2025 and the 13th Five-Year Plan prioritize this development. More partnerships are happening currently as we speak between academic institutes and biotech companies within and outside China. Indonesia. Indonesia's pharmaceutical industry is expected to see increased revenues thanks to the introduction of the government's Jaminan Kesihatan Nasional, the JKN, which is a new universal healthcare scheme. Predicted rises in income per capita will also drive sales of over-the-counter medicines in the coming years. However, what has been more significant for overseas companies is the government's act of loosening ownership restrictions on domestic firms. Previously, foreign investors were only allowed to invest or own 75%. Currently, they are now able to own 100% of them. At the moment, 70% of drug manufacturers in Indonesia are local. However, this figure is expected to decrease in the coming years due to foreign investments, which is expected to be around $20 billion over the next 5 years. Another important driver for biotech research is the recent focus for sustainability in global practices. Bio-based production of chemicals and materials in a sustainable way has been attracting a lot of attention, and some traditional petrochemical companies have started to commercialize bio-based chemical production. Apart from sustainability, growing demand for healthcare has also increased and become an important biotech driver due to increased average life expectancy and percentages over 65 years old. Since I've spoken about Singapore and Thailand, I think what I'd like to probably do next is to share with all of you about the current biotech status in Malaysia. As we all know, Malaysia is richly endowed with a wide array of natural resources that are useful for biotech R&D. Since the launch of the National Biotech Policy in 2005, to advance the development of agriculture, healthcare, and industrial manufacturing, Malaysia has been actively strengthening its biotech ecosystem for the last 15 years, developing its local industry and creating a niche for itself as a reputable biotechnology hub for Asia. The NBP has 9 thrusts aimed at enabling a conducive ecosystem for 3 bio-based sectors implemented over 4 phases. These phases is being monitored and led by the Malaysian Biotechnology Corporation, now known as the Bioeconomy Development Corporation. NBP has resulted in the establishment of many international and local biotech companies with the BioNexus status registered under the BioNexus program in order for them to enjoy fiscal incentives and other privileges. To date, a total of 255 companies and more have been awarded the BioNexus status with an approved total investment of over 3.2 billion ringgit. A recent exciting biotech initiative in Malaysia is the development of the country's first vaccine manufacturing facility in Negeri Sembilan, which was initiated in 2017. Developed by AG Biopharma Sdn Bhd, it has approved funding of USD $34 million over 3 years. In early 2018, AG Biopharma completed its first global vaccine business acquisition in Denmark under the Stratums Denmark Institute, and it was under the auspice of the Denmark Health Ministry. It has a strategic vaccine pipeline, including inactivated polio vaccine, the BCG vaccine, and the tetanus and diphtheria vaccines. These initiatives is expected to contribute to achieving national vaccine self-reliance in Malaysia through tech transfers and manpower once the manufacturing facility is in operation. I'm happy to share with you a small slide on some of the collaborative. There's about 5 or 6 here of the 253 companies which has been enjoying the BioNexus status program. One is the Biocon, which has got a total investment in Malaysia of 500 million ringgit. And the other one is, that is to establish a biomanufacturing R&D facility for research. And the other one is a Korean and a French chemical power Akima collaboration. That is about 2 billion ringgit investment, also under the BNP initiative, that is to build the world's first biomethionine plant. The third is a collaboration between the Japan-based Mitsui Engineering and Shipbuilding Company, as well as Sime Darby, in order to build a bioethanol demonstration plant. But apart from all these 6, I think what's most interesting for me personally is the building of the integrated lobster aquaculture park in Sabah. That is going on underway as we speak, and that is a total investment of about 1.7 billion ringgit developed under the collaboration with Jivo Incorporation. Yeah? Okay. And the last one is the Ranbaxy Malaysia, who is keen to set up a greenfield manufacturing facility, and that has got an investment of about 114 billion. These are just 6 of the examples of the 253 companies under the BNP led by the Biotech Corp. There's a lot more. I'm not able to list everything. Right. Okay, so I've talked to everyone about the opportunities and the countries that are leading biotech in Asia. Despite all these technological advancements that I have explained to you all about, biotech research and development, and primarily in Malaysia and Asia, faces numerous challenges that threaten to hamper our development. Let's look at some of these issues in a bit more detail. The first would be the law and governance here. Regulatory alignment is still holding back international export potential in many parts of Southeast Asia. Okay, this is to do with facilities requiring accreditation from either the EU GMP standards, whereby the countries in Europe and North America require these accreditations for facilities that want to do drugs, or the standards of the Pharmaceutical Inspection Cooperation Scheme, which is the PIC/SGMP. In a recent Asian Pharma Report 2020 for Vietnam, of which there is a huge international investment interest in biopharma, only 17 facilities out of 222 have obtained the EU GMP standards, compared to the other 222 facilities which has got lower level WHO GMP standards. In order to harmonize these inspection procedures across the globe by developing common GMP standards, several countries in the ASEAN region, including Malaysia, are now members of the Pharmaceutical Inspection Cooperation Scheme. However, the downside would be that as facilities tend to be upgraded in order to meet these higher standards, increased costs from generic manufacturers will be inevitably higher. Another concern that is faced in biotech R&D and catching a lot of attention in Asia is compulsory licensing. Compulsory licensing is the philosophy wherein government compulsion authorizes generic drug makers to be able to sell lower cost versions of branded drugs so that more patients can get access to treatment, especially in a public health crisis situation, in the case of COVID or TB, etc., etc. Yeah? Compulsory licensing is basically a very contentious affair. Globally, it is uncommonly used. On the other hand, some multinational companies have granted their own licenses to low-cost drug makers for public health and public relations reasons, particularly on AIDS drugs for sale in Africa. For the branded drug makers, they view this approach as an assault on their IPs, but the government considers that this as a moral responsibility towards their country fellows and citizens. Another concern faced is, in the last few decades, biotech research has resulted in the development and release of several GMOs and emphasis on adopting GE technology for commercial users. As a result, there has been increasing awareness among the researchers, producers, and users of GMOs, etc., mainly due to the concerns about the GM impact on crops and the environment. recognizing the need of biosafety in GE, research and R&D activities, an international multilateral agreement on biosafety called the Cartagena Protocol on Biosafety, CPB, has been adopted by many countries in the world over. Malaysia ratified the Cartagena Protocol on Biosafety in September 2003. In 2007, a Biosafety Act was approved to regulate the release, importation and contained use of LMOs and the products of such organisms. The Biosafety Act 2007 is drafted to be in line with the National Biological Diversity Policy of 1998 and the National Biotech Policy, and covers modern biotechnology activities. Now, the last thing I'd like to highlight is basically the last concern faced in biotech R&D, which is the declining perception of the pharmaceutical industry. When the word big pharma is raised outside of the industry images of images of life-saving drug discoveries rarely come to mind. Instead, the public perception of pharma is often shaped by issues like drug costs, prescription drug abuse, the supposed dangers of vaccines, or corporate greed. In fact, the public perception of the pharmaceutical industry is ranked worse than the tobacco industry among some groups. Reputation Institute RI, a consulting firm which devotes a yearly index to measuring the reputational standing of major pharma companies, found that between 2017 and 2018, the industry's reputation declined by 3.7%. Okay, so in concluding my talk today, continuing advances in biotech provide a plethora of opportunities to address global challenges such as the spread of infectious diseases, food insecurity, and environmental degradation. In the wake of the COVID-19 pandemic, the biotech industry remains only one of the few survivors in the global markets as they become the entity responsible for the development of diagnostics and treatment against an infection that has shaken the world to its very core. In Asia, the leaders of biotech research remain to be Singapore, China, and Thailand, mainly due to strong governmental support and increased collaborations between academia, industry, and their stakeholders. Many exciting biotech opportunities in these countries have been presented. However, the industry is still facing challenges that threaten to hamper the continued development for global growth. Some of these challenges include restricting laws and governance, public perceptions, and most importantly, biosafety and biosecurity concerns. Although at a global level, treaties, conventions, and various guidelines have been drafted to ensure the fair and transparent promotion of biotechnology, these mechanisms fall short of providing the oversight needed to promote the development of biotech-related research. Therefore, steps at mitigating these challenges, be it governance perceptions, would go a long way towards ensuring continued advances in biotech R&D. Okay, so these are my reference. I'd like to finish off by saying a very huge thank you to the chairperson for inviting me today, and also to the sponsors and everyone present here. Thank you.
Thank you very much.
I'll stop sharing. Just give me a minute, yeah? Okay.
Thank you, Dr. Chris. Am I online back? Yeah. Okay. Dr. Chris, am I online? Thank you very much, Dr. Zarina, for your presentation in which you highlighted the role of the biotech industry in the supporting the development of vaccines as well as pharmaceuticals in Malaysia and globally. And I would like to take this opportunity now to invite question answers from the panels or from the participants. So the participants are free to type into the question and answer box, and the panels may type into the chat window. So we'll wait for the questions.
And Dr. Kenneth, the panel are free to ask verbally also, yeah?
Okay, yeah. The panel may ask.
We welcome
the microphone.
Yeah, interactive communication among the expertise. Thank you.
Thank you, Dr. Boeing. We do not have any questions in the chat window. So Okay, we can move on. So I would like to thank Dr. Zarina. Thank you for your presentation. And we would like to move on to our next presenter, Dr. Chris. Thank you very much, Dr. Chris. So for those of you who have just joined in, because I can see that the number of participants have increased, you are now participating in the Belt and Road Initiative Symposium, which is co-hosted by the Malaysia Maritime Silk Route Research Society and the Biotechnology Research Institute, and also co-hosted by Nixon Malaysia, Sendirian Berhad. So with that, I would like to invite our next speaker for this afternoon. Our next speaker is Dr. Devani Purnomosari. She is a senior lecturer and researcher at the Public Health and Nursing Faculty of Medicine, Universitas Gadjah Mada, Yogyakarta, Republic of Indonesia. Dr. Devani has graduated with a PhD in Oncology and Development Biology from the Utrecht University, Utrecht, the Netherlands. She is the facilitator of Good Clinical Laboratory Practices, GCLP team, and coordinator of Biosafety and Biosecurity Faculty of Medicine, Universitas Gadjah Mada, Yogyakarta, Indonesia. She's the ad hoc team of Biorisk Management Laboratory Systems, Universitas Gadjah Mada. She's the member of Assessor of National Authority of Containment, Ministry of Health, Republic of Indonesia, mentor in the Global Mentorship Program, International Federation of Biosafety Association, IFBA, member of the Biorisk Management Technical Committee, International Federation of Biosafety Associations, member of the Indonesian Biorisk Association, and member of the Asia Pacific Biosafety Association. With all of these qualifications, Dr. Devani will be ideal to present to us the Indonesian country-specific perspective on the current pandemic, and I invite her to deliver her presentation now. Dr. Devani, welcome.
Okay, thank you, Dr. Rodriguez, for the opportunity. Also, thank you for the committee that invited me to share my knowledge about condition in Indonesia. But actually, what I will talk about, I will share my slides. So it's mostly for the biosecurity, biosafety and biosecurity for laboratory lab. So if you talk about biology lab, so our main concern now is not only about the pathogen itself or the biological itself, but it's also the zoonotic disease, the emerging disease, and lately it's about the bioterrorisms. And as we might know also that the biological lab has many phases. In Indonesia, I will want to show you. So most of the time, what I will present here is the experience in Indonesian field, and this is what we have in the hospital area, and also I'm sorry, I cannot see. Okay, this hospital area, the laboratory, and this also the clinical diagnostic laboratory where all this lab is using the pathogen or the biological agent, but also the research institute. We have many research institute, for example, like LIPI and Eijkman Institute, and also Badan Litbangkes under the Ministry of Health. And also they're doing the research on biological agent. But what I will emphasize here is also for the pharmaceutical company. We have Biopharma, who actively produce the vaccine, and actually I'm one of the assessor because Biopharma producing the polio vaccine, and now with the eradication of polio, Biopharma should be under monitor that the virus won't escape to the environment. And also for the academic laboratory. So I'm coming from the academic background. So here I will show you about the three big universities in Indonesia, Universitas Indonesia, and Bogor Agriculture University, and my university, Universitas Gadjah Mada. And actually the biggest concern for biosafety and biosecurity for us is in academic laboratory. Because as you might know that we have a lot of students and they have a lot of They study a lot of in many fields. It's not only medicine, but also for other forestry and also for veterinary. So the possibility of their having the variant of research is very possible here. And we will see that here is also that the rules in the academic is not yet applied. And I will see this as a SWOT analysis to see the condition what actually Indonesia have and what we still don't have. So actually this is, I show you some of our regulation concerning the good clinical laboratory practice and also laboratory network on emerging and re-emerging disease. As you might see here, that this regulation is already came long time ago before the COVID area now. And also here the regulation from our president concerning on research and development and application of high-risk technology. So actually all the regulations is already present. And we also have now national biosafety and biosecurity guidelines from the Ministry of Health. But actually we also have the guideline for biorisk in an institution. And so far, not many of university have the biorisk committee. As I know here, institutional biorisk committee is very, very important to monitor what happens in the academic field. And for example, I know for sure that Universitas Indonesia and Institute Pertanian Bogor, they already have the institutional biorisk committee, whereas UNER is just, I think, just recently have. And Universitas Gadjah Mada, as you might know, that I'm the ad hoc committee. So it's ongoing, and we hope that by the end of this year, we will have the institutional biorisk committee. And all this possible because we have the Indohun. I think this is from the private that organization that really concerned about the biosafety and biosecurity in Indonesia. So Indohun stands for Indonesia One Health University Network. So they invite many universities, mostly big one, to involve more in biosafety and biosecurity. But even though all the regulation and things is present, for now we don't see any application and implication of the rules. So we are in a university field. We don't know what happened because, and then the coordination among responsible parties, for example, from the government and the pharmaceutical company, and also from the defense, Minister of Defense, we don't know anything about that. And also, how about the monitoring and evaluation? We don't have that tools to monitor and evaluate whether these regulations is already imply in a daily work. And other things is that we know, I think this is, I took this from Singapore. They have what they call BATA, it's Biological Agent and Toxic Act. And actually we are also working on this, that we need a list of biological agents and toxins. So this thing is also made possible for us to monitor what happens actually in the research in Indonesia. So I also see the threat. I don't know how many of you that know about do-it-yourself laboratory. So for me itself, for us, we just realized that because like, I think the last 2 months we have this training from the US government about do-it-yourself laboratory. Actually, this is the laboratory that never reached by the rules because it's running by personnel, like you say here, citizen for science and science for citizens. So it's not a real laboratory. Sometimes they are perform the research in the garage, or sometimes some of them even in their bedroom or in the kitchen or anything. So for this one, we think that it is a threat because we don't know what they're doing. And also the other threat is by now with the the improvisation of the technology by genomic editing, next generation sequencing, also synthetic biology. And actually we have also like association for synthetic biology running by students. And but by the way, for this one, we know exactly what they do, so we can monitor and evaluate them at any time. But it's also possible that this synthetic biology or genomic editing is performed in do-it-yourself laboratory. So that's the fact that we feel nowadays. And also other things is a human migration. As you might know, that Indonesia is very large, and it's the possible of bringing everything like COVID also. The biological agent is very possible because we have also in the airport, and also from the train, and also from the ship. So from all over the area, from sites, we are threatening that anything could happen and could come to our country. And I asked my friend who are working in a quarantine, actually there's no rules regarding this for the biological agent so far. And okay, for the academic laboratory, like I mentioned, we focusing on this because most of the time there's a possibility for students that to undergo or to perform the dual use research of concern. And in this case, we need a body that, or a committee that will monitor them or evaluate even before they start to do the research. And in this case, we are really relying on the Biorisk committee. But whereas in most of the university in Indonesia, except that 5, I think now it's 6, we don't have like the Biorisk committee. And so therefore, we think that the Minister of Education and Research, should they work together and make us again like a regulation to imply this to each institute or the academic. And so I see also the opportunity that actually now we have the laboratory virus management, and actually I think Dr. Zalini already mentioned about that. Now the ISO 35001 about the virus management for laboratories exists. So we hope that by having this national and international standard, we also have the Pedoman Management Virus Laboratory for COVID-19 now by standardization body, national standardization body. We hope that it's this COVID will give us, how do you say, it's blessing in disguise, that nowadays our government and also many people start to aware about the biosafety and biosecurity. As previously, it seems that it's nothing. And we also have international and national association. We also have the certification bodies. So I hope that we can involve them more to improve our biosafety and biosecurity awareness among all the people in our country. And so what I recommend with based on the strength, the weakness, and opportunity, I would like to recommend, and I think this is my last slides, is that most probably that the certification, for example, we have the accreditation and also standardization. We need accreditation that these things can do it via app. So it's very easy. We don't have to go anywhere, and then we can have the achievement for the certification. And also, I think lately, due to the pandemic of COVID, we run a lot of trainings, mostly to the institute, to the laboratory that undergo the diagnostic. So nowadays, at least more than 50 trainings like every day. And we also would like to, if possible, that this biosafety and biosecurity as part of the curriculum could be from elementary school, if not, then probably from high school. And we would like also to invite the community awareness. But in this case, then we need to have to train them and to make them aware about the biosafety and biosecurity. So I think the point of entry from this is from the school. So actually, we also start to introduce to our students about biosafety and biosecurity at the beginning of their study. And by having also biorisk laboratory management in each institution, by having institutional biorisk policy and also institutional biorisk committee, we hope that it will help the government to monitor about the biosafety and biosecurity condition in each institution. And also by having the association, they can ask the association to help them to run either the trainings or anything, because they are the one who competent in this field. I think that's what I can share with you from Indonesian side point of view. Thank you very much again to invite me to involve in this symposium. I give the time back to Dr. Rodriguez. Thank you so much.
Thank you very much, Dr. Devani, for your interesting presentation on the country-specific perspective of Indonesia. And what comes out from your presentation is it concurs with most of the statements which Dr. Zalini has also mentioned. There's an increasing need for regulatory frameworks. There's an increasing need for cooperation between countries. As you have highlighted, the area is the do-it-yourself labs or synthetic biology, and that is also being raised. And in fact, during previous presentations, many researchers, we have looked at the scenarios, possible scenarios where people do their own synthetic biology or develop their own viruses in their backyards, and then we end up in the situation like we have today. So this is a very interesting perspective. So I would like to invite any questions from the audience for now. So you have all experts with you. Please pose your questions and clear your doubts. As I think Dr. Damian has pointed out earlier, please don't get caught up with all the misinformation and the rumors, as this can have an effect on you psychologically, and it mostly you need proper guidance from the scientists. So this is a perfect opportunity for members of the audience to pose questions to our panels, and also questions related to regulatory frameworks as well. So is there any question? So the panel is free to interact in the chat box. Both of these panels are visible to me. So do you have any questions? We are looking forward to your questions, because this is an opportunity for everyone to clear their doubts regarding COVID-19. Okay, if we have no further questions. So Dr. Devani, thank you very much for your presentation, and thank you for contributing to this important discussion. So we now move on to our next presenter for this afternoon. Dr. Joseph Lee Han Kun is well known in Sabah. He is a medical consultant who's a family medicine specialist. He's a graduate with a medical doctor's degree from the International Medical University in General Medicine. He's a former head of the Clinical Research Center, Queen Elizabeth Hospital, Ministry of Health, Malaysia. He's an ISO 900-2000 auditor, the lead auditor in the quality management system. He's a member of the Malaysian Medical Association and a member of the Academy of Medicine of Malaysia and the Academy of Family Physicians of Malaysia. He's a lecturer of the School of Medical Science in Open University. So with that, I would invite Dr. Joseph Lee to present his topic, which is very interesting and it relates to the vaccine. So the title of his presentation is Recent Vaccine Candidates Developed for COVID-19 from a Medical Practitioner's Perspective. Welcome, Dr. Joseph.
Thank you, Dr. Kenneth. Let me put my slide up.
You can proceed to put up your slides.
Yes.
So you share a screen.
I still cannot yet.
Yeah, just do it slowly. It's a sometime bandwidth.
Okay. All right, thank you.
Okay, it's perfectly okay now. Thank you, Dr. Joseph.
Your kind introductions. Okay, today I would like to talk about this vaccine. We'll start with the vaccine first. First of all, there are different types of vaccine in the world. I will just run through it quickly. We have the live attenuated, we have the inactivated, subunit antigens, and toxoid. These are the different kind of vaccine that we can see here that we are already have it in the market today. And then why do we need to have immunizations? Basically, it is to promote health, is to have an expensive reach of the treatment of these preventions of diseases, and also to have rapid impact. For example, in year 2008 to 2008, the rapid reductions of global measles by 78% just by vaccination alone. And then vaccine also save lives and cost. Like today, we can see that the impact of COVID-19 is so bad that it actually affects it across the border throughout the whole world in terms of economically, socially, and so on. So what are the questions that we ask as a doctor when we want to institute vaccine to our patients? So the first thing is we need to consider whether the patient want to take it or not, because vaccine is usually given to people who are healthy. And for a healthy person to accept something, it is something that they really want to ask a question about safety and so on. So it is very important for us to look into the safety and regulations and the types of vaccine that are being used, and continuous monitoring. We need to consider the phases of the trial and also post-marketing surveillance as well. And as we know, most of the vaccine being developed for COVID-19 a double dose, which means it's to be taken 2 times, basically is to increase the number of immune response. And there are 2 types of immunity which we know very well. We have the natural immunity and the vaccinations. In summer experience, we have a lot of people being infected and they recover after 14 days, and we call them natural immunity. Most of them are okay. Now the challenge is on the vaccine side. And in order to use a vaccine, we need to consider a lot of, we need to put in a lot of consideration, especially on this adverse reactions. And the vaccine is being used, they could be side effect due to the product itself that is being used to preserve it, or due to the quality defect in the product itself due to properly temperature issue, and then error-related issue, yeah, and then anxiety-related. Some people are so anxious about vaccination, and also coincident event that maybe a person has underlying disease at the moment. And if we look at the coronavirus vaccine tracker, there are actually about 41 in phase 1 and 17 in phase 2, phase 3, 13, limited 7, and approved 0. Actually, none of the COVID-19 vaccine is approved at this point in time based on the existing trial. Most of them are at phase 3, even the Pfizer and even the China vaccines also under phase 3 trial. And if we look at this traditional and accelerated vaccine development pipelines, as we can see in the number in the picture on top here, in a normal situation, vaccines is developed over a period of at least 15 years or longer, because we need to go through the phase 1, phase 2, and phase 3, and each phases require about 1 to 2 years. But in the case of COVID-19 vaccine or SARS-CoV-2, we have put it into, we have shortened everything to about 10 months. And as you can see, sometimes phase 1 and phase 2 are overlapping, and even phase 3. When the trial has not come out in phase 1, phase 2 has kicked in. And then even phase 2 has not completed, phase 3 has come in. So we are facing this kind of accelerated vaccine development and trials. These are the different types of vaccine candidates that we are seeing today. We have the inactivated virus from Sinovac, from China mainly, and then the viral vector RNA from Pfizer. We have done a lot of trial in other countries such as US, Argentina, and Brazil. And all these are still on trial. And as we know, Malaysia has put an order of 12.8 million doses from Pfizer. Pending, I think, is pending on the result of the phase 3 trial as well. Okay, I will just briefly mention a bit on BioLab, even though it's been mentioned earlier by our previous speaker. Just run through the history of biolabs. Actually go back as early as the year 600 BC. And a lot of people has been using this biological substance, either the virus or microorganism itself, or the toxin produced to create havoc. Yeah. And then in the world of bioterrorism, the famous one is in the year 2001, where in the US, there were anthrax outbreak and create a lot of fear over there. And in terms of history of biological warfare, in 1943, U.S. Biological weapon program was launched during the time of President Franklin Roosevelt. And in 1969, the biological offensive program was discontinued by President Richard Nixon. However, in 1975, U.S. ratified both the 1925 Geneva Protocol and the 1972 Biological Weapon Conventions. If we look at year 2018, the National Biodefense Strategy was released by President Donald Trump in response to counter and reduce biological threat, which is quite recent, 2 years ago. And this is the actual documents on the 1925 Geneva Protocol signed to prevent the use of gases or bacteriological substance for bioweapon purpose. In 1972, there was a biological weapon convention being signed, again, to prevent the use of microbiological agent for development of bioweapon. It was signed by 103 nations in 1972. When I checked with the latest statistic in October 2020, it has been signed by 183 countries. The route of delivery for biological agents usually is, the most effective one usually is by aerosol, just like H1N1, influenza, Ebola, and even through this COVID-19. And events suggesting the release of a bioweapon will be multiple people ill at the same time, and then a previously healthy person get affected, and then high mortality and morbidity among affected individuals, identifications of diseases and pathogens unusual to a particular regions, recent terrorist claims or activity. Usually when there is a bioweapon being released, there will be somebody who will claim severe respiratory disease in a healthy host, an epidemic curve rising and falling rapidly, increase in fever, respiratory and GI symptom, lower attack rates in people working indoor versus outdoor, because the agent was, if it is released outside, then there will be more cases outside, and seasonal disease during a different time of the year, and non-pathogen with unusual microbial resistant pattern, and genetically identical pathogen in different areas. These are the different kinds of biological agents that can be used: anthrax, plague, tularemia, and bacteria group, virus group, and toxin groups with different incubation period. The question today that the association put up to me by the Persatuan Penyelidikan Laluan Sutra is that, is there such thing as biolab still exists today? So when I searched it, I found out that there was a news release in August last year where a research lab was closed in the US due to this kind of testing. And there was actually a biological lab in Fort Detrick in Maryland. It was closed because of, they found out that there was some problem with the security in terms of the biological agent that they were studying were released from it, such as Ebola, smallpox, and anthrax. So because of that leak, they immediately closed down this facility. And according to this, the Russian foreign minister, Sergei Lavrov, he said that there were a lot of laboratories constructed by the US government along the perimeter of the border of the Russian Federation, and accordingly next to the border of the Republic of China. So these are the claims that was done with the Shanghai Cooperation Organization, a group, a pact that is involved in Eurasian Political, Economic, and Security Alliance. So they were voicing out the concern about the movement by the US government in building this kind of lab across the border near to China and Russia. And in the Vietnam War, you know very well, Agent Orange has been used, which contains dioxin. How about SARS-CoV-2? SARS-CoV-2 was, some people were saying that it might come from China or from Wuhan, and even the US president called it the Chinese virus. So it has created so much of discrimination and problem. But then scientifically, according to Jonah Mazet, professor of epidemiology at the University of California, he found out he was the director of PREDICT program that involved in monitoring emergent viruses. And he commented the Wuhan Institute of Virology were trained by US scientists as part of the PREDICT program and follow high safety standards, and that all of the evidence point to this not being a laboratory accident. So even he agreed that the virus was not coming out from Wuhan. Yeah. So PREDICT program was actually an epidemiological research program funded by the United States Agency for International Development and launched in 2009. And the program was described as an early warning pandemic system. So there are many news releases saying that this COVID-19 virus actually existed in US long before it happened in China. And when I checked into the journals, and I found out that they have done actually a serologic test of US blood donors since December last year to January, and they found out that there were quite a number of patients' blood were positive with antigens for, antibody for SARS-CoV-2. So it become a question whether this SARS-CoV-2 virus actually existed in the US long before it became an outbreak issue in Wuhan. Then another issue that was brought up to me is the presidential debate between Donald Trump and Joe Biden and the involvement of Dr. Anthony Fauci. So I just run through quickly about what they have talked, what is their take on the plan to end COVID-19 pandemic based on their speeches, tweets, and websites. And as you can see, the reopening of the economy is similar. This is Trump, the red color, the blue, or the green is Biden. Both of them are in support of opening the economy and opening the school. A stimulus plan as well. But as far as mask is concerned, Trump is very low on that. He opposed to it, while Biden is supporting of it. Vaccine approval, both are quite equivocal. And in terms of masks, as you can see, Trump opposed and non-specific testing. Trump very supports for a lot of testing. And vaccine approval, again, Trump. And there's another therapeutic issue that happened. Remdesivir was used to treat COVID-19, and it was approved by FDA. But later on, it was withdrawn by WHO based on the Solidarity trial, which shows that it does not reduce mortality or the time of COVID-19 patients take to recover. Yeah, and then another issue on chloroquine and hydroxychloroquine, which was promoted by the President of America, and later was found to be unlikely to be effective in treating COVID-19. It was also withdrawn later on. Again, therapeutic approval, President Trump more into that. And then Fauci. In this campaign, Fauci made a comment that Democrats seems to be more concerned about COVID-19 as compared with Trump. And then oftentimes Fauci is found to be in contradictions with Trump in terms of the strategy to fight against COVID-19. And if we look at this graph here, in around September, the cases of COVID-19 in the US has dropped quite well, but at about 5 days before the elections, American elections, the cases has increased so dramatically, mainly due to mass gathering, no social distancing, campaigning and open campaigning and so on, and also not wearing masks. And the entire US is not spared of COVID-19. If we look at the CDC guideline, wearing masks is actually one of the recommendations, SOP that was recommended. And even in Malaysia, wearing masks is also unimportant and can be fined if you don't wear it based on the law. Then lastly, I will talk quite a bit from the speech of President Xi Jinping in the IPAC meeting last November 20. His speeches was entitled Working Together for an Asia-Pacific Community with a Shared Future. And he mentioned about how the Asia-Pacific members should be working together and inclusive and in the sharing of experience on how to control COVID-19. So I just take WHO guidelines on the primary prevention, secondary preventions, and tertiary preventions, where China has been in the forefront in the vaccine development and even in productions of PPE. And secondary prevention, they have also established a very good screening system where they can detect a lot of numbers of cases in Wuhan, and therefore was able to tackle the issue at hand. And tertiary preventions, where they established hospital within a record weeks, you have the hospital facility to treat the patients. And because of that, the curve was flattened over the time. Even in Malaysia, we have flattened it. But as I have seen from previous speaker, the curve actually go up after the Sabah elections, which is a true story. And overall, what we can see over here is that in order to really have a proper preventive measure in a country, we need to, number one, look at the influence. We need to influence the policymaker. We need to go to the legislation, to the country, to the leader of the country, especially to the political leaders who will make legislations and policy regarding the fight for COVID-19. And only when they make the right policy and decision, such as MCO or CMCO, then it will help us to handle this issue based on medical advice. And then mobilizing neighborhoods and communities where everybody is involved, fostering conditions and networks, again, networking, changing internal practices and policies of agencies and institutions, we call it new norms, educating healthcare providers and other professionals. We also get a lot of experts from China to teach our healthcare professionals on how to handle COVID-19, promoting community education, strengthening individual knowledge and skills. These are the whole spectrum of prevention that need to be intact in the country so that we can handle not only COVID-19, but any other kind of diseases. He also mentioned the importance of smooth transition and supply chains of vaccines, of goods and services. And if I put that into vaccines, we can see that of all the vaccines that has been almost available now, we can foresee that the vaccine produced by China and also Russia and also Oxford, they were actually kept at regular temperature. So that makes it easy for transport and storage. And in Malaysia, as far as we are concerned, our Ministry of Health and even university hospitals, we have this kind of refrigeration, which is commonly available, and it's easy for us to use it. If we were to use Pfizer, which require negative 70 degrees Celsius, it poses another challenge, which I think the government is looking into it, how to store this vaccine, because it cannot be stored for too long, and after it's been opened, it cannot last that long as well. And China is working very hard in the transport system to deliver vaccines. And I think that's all. Thank you. Thank you.
Thank you very much. I think you can, okay, you'll have to.
Let me find the.
Yeah, it's at the top of the screen usually.
Let me find it. Stop.
Okay.
Let me find it. Stop.
Okay. I think we'll have to.
Okay.
Thank you very much, Dr. Joseph. Thank you for highlighting the development of the vaccine. The presentation was very informative and it provided a perspective of the development of vaccines as well as the emergence of the new developments in the area of vaccination. Now, with regard to the vaccine, there may be many questions from the panel as well as from the audience. So I'm looking at the audience question. So the first one is from CV. It's, I think, Dr. Chris. His question is related to the vaccination priority itself, not the actual vaccine, but the priority. His question is, should previously infected patients with very low antibody level serology tests be vaccinated again? So what is your take on that from the perspective of a medical doctor?
Okay. As of now, we don't actually have a very specific serological test at the level of protective level of the antibody being produced by the body. So we can safely say that when a patient has recovered from the disease, they should have naturally produced IgG and IgM that can protect them against the future infections. But however, we have seen quite a number of cases after they are been infected and recover, they do not show any IgG or IgM seroconversion. They don't develop antibody. So with the blood, we do a surveillance study on the host infections. They do not develop it. So this is something that we still need to study further. That's why I would like to get more data on this. And we hope the Chinese government and Pfizer can give us the data, see how is the level that we are expecting and the protective level. So far, we haven't seen what is the level to be protected. For example, hepatitis B, 110 IU unit, we say is protected, right? But in COVID-19, we haven't seen a figure yet.
Okay. Thank you, Dr. Joseph. So that is indication that there may be other mechanisms which we are not aware of with regard to immunity in this case. It may be some other kind of a non-specific host defense also. So we need that data. So I think the data coming out from China as well as from the studies will give us more insights into this mechanism. The next question which we have is from Professor Chai Fook Yi. So he said, Dr. Joseph, can you comment on herd immunity as a way of fighting COVID-19? To what extent of our population should be vaccinated in order to achieve this? So just to explain to the audience, I will explain about herd immunity is basically the immunity which is conferred on a certain number of individuals in the population, and that breaks the chain of infection in the community. So to answer the question, I will turn back to Dr. Joseph regarding this herd immunity issue.
Okay. The challenge that we are facing in Malaysia now is that we don't have the number of vaccine that we need. We have a limited number, even though we have signed an agreement to buy 12.8 million vaccine, which can vaccinate 6.4 million population because of the two-dose issue. We are still vaccinating about 20% of our population. So we need to increase to minimum 70% to be able to create this kind of herd immunity. In fact, if we look at Sabah, in terms of, let's say, TB, okay, TB vaccination, we don't have much TB, even though relatively still higher than Malaya, Semenanjung Malaysia. But we, in a way, we are still protecting our so-called foreigner who are, the issue we have here, illegals. Well, we are protecting them from getting it because of the herd that we are producing, of Malaysians. So in terms of the number, I think it's about 70%, which should come to about, in a population of 30 or 33 million. I think we can calculate that number, about 70%, Yeah.
Thank you, Dr. Joseph. So we would also like to extend this discussion because we have maybe 1 or 2 minutes regarding the most common question which will be posed by the public is the safety of the vaccines. So now if you look at it from the purely from molecular biology perspective, we know that RNA is a molecule which is not stable. So we'll inject it. So the vaccine uses lipid delivery, and then you'll have a expression of the antigen and so on and so forth. And the vaccine will be basically not going to have a cumulative effect. So do you have any comments for the public regarding efficacy and safety basically of vaccines?
There's a big difference between mRNA vaccine and inactivated vaccines. In terms of design, the inactivated vaccine is actually a complete vaccine, complete virus. So when you have a complete so-called virus, the body can produce antibody against different parts of the receptor or the structures of the virus. So it will make it more effective in a way as compared with mRNA, which is only targeting at the one molecules or organelles. And somehow mRNA is very, as you said, Prof, is very fragile, and it has to be kept at a very low temperature. Otherwise, it will degrade and disintegrate and become less effective. So these are the challenges. And in terms of experience, I think mRNA is very new. And again, we need to wait for data. We need to ask for the data from the manufacturer for the mRNA vaccine, as well as the inactivated vaccine. Then we can tell.
Dr. Kenneth, I think there's one question from the attendee in the chat box. He dropped it in the chat box. Can you see his question from Dr. Hasmi to Dr. Joseph? Dr. Kenneth, we can't hear you.
I think it muted me. The system muted me. Can you hear me now?
Yeah.
Okay. So I will read out the question from Dr. Hasmi to all the panelists for the benefit of everybody. So the question is, thanks to all the panelists for a very informative talk. My question is, there have been thought-provoking claims that COVID-19 is a pandemic instead of a pandemic. It would be interesting to know what the panelists would think about this. So it's basically opinion from the panelists regarding the issue of pandemic, the technical definition as pandemic. So the panel can answer perhaps.
I think I'll just give a piece of my opinion. The pandemics, endemics, all these are just epidemiological definitions. It's just a definition. So pandemic refers to a disease that has spread worldwide. Endemic is something that is localized. Let's say we have endemic tuberculosis in Sabah, for example. This is endemic. For me, it's just a terms to describe the gravity of this disease, which has spread throughout the whole world. As far as pandemic is concerned, the world is concerned, yeah.
So I think that answers the question from Dr. Hasmi. It's basically a matter of definition and technical terminology when it comes down to the definition of pandemics in the vocabulary of medical science. Do we have any other further questions from the audience? So I'm checking my chat and there are no further questions. Actually, this is a perfect opportunity for the audience to pose questions to the panel, because the panel is well experienced in this area of vaccines. Especially there may be a lot of questions from public related to safety of vaccines, and now we have groups of vaxxer and no anti-vaxxers and things like that going on. But there are no questions from in my panel window. So if there are no further questions, I would like to thank Dr. Joseph. Thank you very much, Dr. Joseph, for sharing your expertise in this area of vaccine development. Thank you very much. And we will now proceed to our next speaker or the closing ceremony. So I will invite Dr. Zarina Amin, who is the co-chairperson of the BRI Symposium, to give her closing remarks. And I would like to thank each and every one of the speakers for having contributed to this important collaborative workshop and symposium. Thank you very much.
Okay.
Dr. Zarina, please, the floor is
yours.
Excuse
me, I think we have one more question.
Okay. So we have one
from
more
Prof.
question.
Mai in the chat box.
Okay,
yeah.
So there is a question from Professor Dr. Clement. So I'll pose this to the panel. And the question is, since the RNA-based vaccine needs proper storage, what is the chance that a patient received a defective dosage that didn't work, and how can we detect that? So I pose this to the panel. So Prof. Michael's question, maybe Dr. Joseph can answer with your
Yes, thank you for the questions. As we see, especially for Pfizer's vaccines, or not only for Pfizer, but any vaccine that require very low level of temperature to store, the chances is there's always a chance that it might get defect due to temperature variations. The chances is there, but to detect it, I don't think it's easy. Probably it's just if we look at the normal way we look at the vaccines, we look at we call it the turbidity of the vaccine, for example. If we change color, then we can. Otherwise, there's no specific way we can detect whether the vaccine has been damaged or not. Because if we look at, for example, this we call it Pfizer's vaccine, it required to be thawed. So it's frozen form. So when it is thawed and then we rethaw it, there's high chance that you thaw it and refreeze it, there's a high chance that the molecular structure will be damaged. It might not be usable after that. That's why after you thaw it, you cannot freeze it again. You have to keep it in the 2 to 8 degrees Celsius for very limited time before you use it. So I think those is what I call quality control issue, the handling issue. People need to be taught how to use it, how to handle it properly. Otherwise, there is always a chance that it can get affected or damaged. Yeah.
Thank you, Dr. Joseph, for your answer to that question. There is actually a question in the question and answer. So if Dr. Zarina permits, can I take the question, Dr. Zarina? Yeah,
yes,
okay,
please, go ahead.
I will take the question. So this question has come into the chat box. It's actually a multiple set of questions. So I'll open it to all the panelists. And this is related to the situation itself on the ground in Malaysia. So it has been nearly a year since the COVID-19 pandemic. This is the way the question starts. What are the new characteristics of the Malaysian pandemic situation? What is the specific assessment on the development trend of the pandemic? What are the new risks Malaysia faces in the prevention and control of the pandemic? And what are the countermeasures to face this risk? So this question is basically asking the panel about the current situation, the scenario, the risk assessment for that scenario, and the risk mitigation for this scenario. So perhaps I open this to the panel, and perhaps Dr. Zalini or Professor Sazali can address these issues as you have covered these in your presentations, or any one of the panel.
I think Prof. Sazali has left. He say he has something to do with the grant defense. Yeah. I hope he's still here. Yes. So otherwise, this question will be very good for him.
Yeah, because he knows the situation in here, knows the epidemiological aspects of the...
Yes.
So if there is no answer, nobody from the panel will answer this question. I think we'll move on to the next segment of our symposium. So we'll move on to the closing ceremony. So I now invite Dr. Zarina Amin, the co-chairman of the BRI Symposium, to deliver her thanks and her closing remarks.
Okay, thank you, Dr. Kenneth, for that wonderful management of those various interesting questions that we had just now. I think it's a shame that some of these questions couldn't be answered, but I think it's really pretty relevant in the wake of the COVID-19 vaccine deployment that is going to be happening pretty soon. If I'm not mistaken, yesterday we had the first UK folks that had the first injections of the vaccine. I thought I saw it on the TV lah. But anyway, so we have come to the end of the session. So I think I'll just start off. I think everybody's a bit tired already. So a very good afternoon to Professor Dr. Wilson Yong, the President of the Malaysia Maritime Silk Route Research Society, Dr. Damien Lee, the Chairperson for this BRI Symposium, our esteemed and respected panel of speakers, distinguished participants, beloved colleagues, ladies and gentlemen. The Biotech Research Institute of University of Malaysia Sabah, together with the Malaysia Maritime Silk Research Society, are proudly co-organizing the Belt and Road Initiative BRI Symposium with the title Safety Regulatory Challenges of Transnational Biotech R&D Projects 2020. This symposium has been kindly sponsored by Nixon Malaysia. In this symposium, well-known expertise from Malaysia and Indonesia are invited to share their views and knowledge on several topics related to regulation, biosafety, and challenges of conducting and control of biotechnology R&D in the ground as well as in laboratories. The invited speakers have been that came today were Professor Dr. Hajah Zalini Yunus, who is currently the Senior Director of Science and Technology Research Institute for Defence, STRIKE, under the Ministry of Defence. Professor Dr. Sazali Abu Bakar, who is the Director of TITREC from UM. And then we also had myself, and then we had the wonderful Dr. Dewajani from Universitas Gajah Mada, and also Dr. Joseph Lee from who is currently a medical consultant and former head of Queen E Research in hospital. Over the last 2 hours, we have heard our panel speakers share with us their topics of expertise. I personally felt that each session was jam-packed full of information and knowledge for us to know and to learn. I truly did not believe that we managed to learn so much about COVID-19 and biosafety and biosecurity risks in a span of less than 2 hours. We had Dr. Hajar Zalini talk about the fundamentals of biosecurity and biosafety, in which she also shared with us the biosecurity challenges of research with regards to dual use potential. We also had Prof. Sazali shared his experience in TIDRAC as a second line diagnostic lab in the management of COVID-19 outbreak, especially in the Klang Valley. We had Dr. Dewajani share with us some guidelines and suggestions of biosafety and biosecurity in academic labs based on her experience in running various research and academic labs in Indonesia, as well as her sound suggestions for biosafety management. And finally, we had the wonderful Dr. Joseph Lee, who shared his vast experience with us on vaccine candidates for COVID-19. I think you were the most popular speaker of the day because everybody asked you so many questions, Dr. Joseph. Anyway, from the presentations of the speakers, I truly believe that the purpose of this symposium had been truly accomplished. I hope, like me, we have all managed to acquire deeper understanding about the topic at hand today, as well as on COVID-19, as it is very relevant and very much aligned. It has been our pleasure in the Biotechnology Research Institute to work with Prof. Dr. Wilson and Dr. Damien Lee as our co-organizers. I would like to take this opportunity to firstly thank the panel speakers for sharing their experiences. Yeah, so namely Dr. Hajar Zalini Yusof, Prof. Dr. Sazali, Dr. Dewajani Purmosari, and Dr. Joseph Lee. I would also like to take this opportunity to thank the Malaysia Maritime Silk Route Research Society, Professor Dr. Wilson Yong, the president and also the advisor for the symposium, Dr. Damon Lee, the chairperson for the symposium, the sponsor, Nixon Malaysia, Sindra Berhad, and of course not forgetting my beloved colleagues who worked very hard for this symposium, namely, most importantly, Dr. Cheong Bo Eng, the head of Secretariat, Dr. Hidayati Yusof, the head of publicity, Dr. Christopher Wu, the head of technical, Encik Hastan Rosli, Dr. Chaya Budiman, and the rest of the team. Also, I would like to take this opportunity as well to thank all of the wonderful participants who has been with us today, who had sat through tirelessly over these past 2 hours. I hope that we have all learned something today, and then we can take home with us some important messages from all the panel speakers. Therefore, I would like to close my remarks and officially announce the end of the symposium and wishing everybody the best and future prosperity for all of us here. Thank you very much.
Thank you very much, Dr. Zarina, for your closing remarks. With that, we have come to the end of our session today. So we look forward to increased collaborations in the area of biosafety and biosecurity at the national level as well as the global level. And we would like to thank our organizers and our sponsors. So we are sponsored and co-organized with Nixon Malaysia Sendirian Berhad, as well as the Malaysia Maritime Silk Route Research Society. So thank you very much to the organizers, and thank you very much to Dr. Boeng and Dr. Christopher, who have been managing the session remotely. Thank you very much, and please stay biosafe. Okay, good evening to everyone. Bye-bye.